Hello, my name is George Fall. I'm a general surgeon with Fall General Surgery in Ashland, Wisconsin and Duluth, Minnesota. I'm a board certified general surgeon and a fellow of the American College of Surgery. I've been practicing for 23 years. I want you to come visit us at fallgeneralsurgery.com and please enjoy the video. Colonoscopy should be done on virtually everybody. The age that we start is generally 50 years old, and then every 10 years we ask you to come in for a screening colonoscopy. And that's most of the people. There are people who need to have it more frequently based on diseases that they may have or genetic disorders that they may have, or if they've had previous polyps. If they have a family history of colon cancer, certainly we do it more frequently. The colonoscopic preparation is done a few days ahead of time, where you stop eating fibrous foods and nuts, and you work on more of a soft diet or clear liquid diet, especially the day before. We give you a bowel prep to use. In my case, I use Go Lightly. Go Lightly is a powder in a 4-liter container. We have you fill that up to the top, or there's a line, and you end up drinking half of that at about 3 in the afternoon the day before, and then you save the other half and you drink that at 3 in the morning. And that gives us a very good look inside your colon, so we can detect any abnormalities that may need to be biopsied. So where are you going to get your colonoscopy? The colonoscopic examination can be done either at Memorial Medical Center in Ashland by myself or at Lake Walk Surgery Center. Some people wish to do it at Lake Walk Surgery Center for whatever reason. Sometimes it's a financial reason, sometimes it's a reason of maybe you're too embarrassed to have it at MMC where you know some people. Fact of the matter is, the people at Memorial Medical Center are very professional, as are the people at Lake Walk, and they do this all the time, and it's a very frequently performed test, and it's something that you shouldn't be embarrassed to have done. We have you come into the hospital, you get an IV started. You've already done your bowel prep. You have the nurses prepare you in the suite where we do the colonoscopies with blood pressure monitoring and pulse oximetry. We give you sedation. We want you to be comfortable throughout the procedure. The procedure then, after we've got you sedated, you're laying on your left side, and we introduce the colonoscope through the anus and direct it through the colon all the way to where the colon begins, just after the small intestine. The colonoscope then allows us to visualize as we come out very slowly. Over a 6-minute period of time we want to come out. Our withdrawal time is important because we want to detect these polyps or any other disease that you might have in your colon. The colonoscope then allows us, if we need to either pinch out, biopsy out some small polyps, or snare and use some heat and cautery to remove polyps that are larger. After we get those out, they'll go to the pathology department and be reviewed by the pathologist under the microscope to tell us what the polyp looks like. The nature of the polyp then is reviewed with you after a few weeks in the office, and we want to make sure that you understand, based on the type of polyp that you have, that'll determine when you should have your next colonoscopy. So get your colonoscopy. It's a good thing to do. It's just part of maintenance on your body, and it's a prevention of cancer. We want to try to eliminate colon cancer by screening everybody we can to get those polyps out before they turn into cancer. Get your colonoscopy.